well, I had worked in doctor's offices previously, so I knew something about health plans from that side. So as soon as I went to work for the post office, I signed up for the NALC health plan because I could see that it was a good one and have been with it ever since.
Well, one of the selling points that I've talked to the members about is the orthotics, because we walk every day and our feet is our major concern with letter carriers, and that we can get orthotics and special things that we need for our feet. And we can get those without having to pay enormous fees of what orthotics cost today in the medical field. You know, it's just ridiculous.
But my daughter, being a child, she went under my plan, had knee surgery. They actually sent her home therapy. The benefit paid for that. They came in, therapists came in, gave her that machine.
I had my kids about 25 years ago, had lots of complications and lots of expenses. And every time I looked at those babies, I said, thank you, NALC.
The few times that I've used a plan for surgery, there was never a problem about certification. There was never a problem about paying the bills. Everything went smooth and was something I just took for granted and didn't have to worry about.
Everything's been great. I mean, if I want to go see one doctor, I can go see him. I don't have to wait for authorizations. I don't have any paperwork to fill out. Co-pays are decent, so never had any problems.
With the HMO, it's only certain people in their network, and it might not be a good doctor or the doctor that you want to see. But with the NALC health benefit plan, you have just a great wide range of doctors and facilities you can use, and it's all available to you.
I noticed that all the doctors that I had prior to getting in the plan, they were all on the plan. So I didn't have to do anything but call them up and say, hey, do you take my plan? And they said yes, and I got it. Didn't change anything. It continued on the same way.
The prescriptions are a lot easier to deal with. I didn't have to get referrals anymore. You know, with two little kids, they have problems, and then you have to go get referrals. I don't have to do that anymore. Not with the plan. You just use who the doctor says go to, and boom, you're done.
Well, I tell you what, we've had real peace of mind with the plan. I mean, we've gotten great service over the years. Never really had any problems or any worries with our claims. In fact, when I ever had any questions about anything, I would just call the plan, and one of the representatives would talk to me about it and guide me through the issue and address my concerns. So, never had an issue.
The plan's just been really good in, if we have any questions, you can call there and you get an intelligent person, and they're actually happy to talk to you, and they have the answers.
In fact, every time I've called, I've gotten somebody that knew what they were doing, and they pulled my file and gave me the answer, whatever it was. And I appreciated that. With a smile, you know, I could tell that they were trained to do that. Yeah, I'm proud of NALC. I'm proud of them.
And I'm kind of proud to say that when they ask me what my insurance is, NALC, you know, I've got this insurance. And people have recognized that's a good insurance.
You compare the plans, there isn't a better plan out there, and actually any plans that come close to us cost more. So we have more value, you get a better deal.
But I hear people saying they're paying so much, and I look at what I'm paying, and it doesn't compare.
Our prices are better than competitive. I would say we're the leader in value.
I don't get half the bills I used to get. So NALC Health Benefit Plan has really been good to me and my children.
And what brought us a lot of members is when they looked at the cost for what they're getting. We're not paying high salaries to people to administer.
Oh, I've always said that they're there to support the NALC member. They work with the doctors to make sure they get the right care, but they're there to support the member and make sure that they get the right care.
I would never be part and party to something that had to control my health care. It's important that I have a say and my doctor has a say, and that my doctor's not being micromanaged and my conditions or my health are not being jeopardized by somebody who wants the almighty dollar at the end of the line.
Then, like I said, if you got any issue, I don't care what your issues are, the plan covers it. So that's why I said it's, you know, it ain't, well, okay, well, we don't take care of this, we don't take care of that. That's not the issue. You know, thing is, if something's wrong with you, you can go get help.